Yeah? Okay.
Never thought I'd say that.
In the back, and I'm not going to turn it around, but in the back there's a little air filter back here. This has to just be washed out with water, and you can pat it dry with some paper towels in between patients. It'll filter out the dust and stuff from the air. And if you don't wash it out periodically, it's going to get like a dust ball. So, and it just goes in here and snaps into the back. It's very obvious.
That's good. I know that now.
And that would only be done in between patients. Then, okay.
You know what though?
So if somebody's on ventilated, that same ventilator
200
for
and
2
200,
nights.
so that's
You might
probably
have to,
why.
yeah, that's a good point. If somebody's on this particular vent for a really long time, you guys, you might need to check that to make sure that it hasn't collected a lot of dust. So it's just a mesh filter. The other thing, keep that in mind, that needs to be open. So you don't want it pressed up any, like if there's curtains in the room or things like that, make sure they're not up against that spot because they won't be able to pull the air in. So you got to keep that open. And then in the back, actually I do need to turn it to show you this. So I don't know if that's as good. Okay, there's your filter I was talking about. Here are main breaker switches per se, for lack of a better term. They're almost always on. So, but if those are not on, the vent won't turn on. So if you turn your vent on and it doesn't work, come check these. This does not really bend, it's screwed in, but you can take a pen or something and put it up in there to flick it on. I've had to do it before. They've gotten turned off before. So keep that in mind that you might have to do that. You'll see that this cord down from here to up to here is your battery, and then this is going to go into the wall. Good? Good. Okay. So then when you turn this vent on, if you're going to just turn it on and it's already been through its self-test and service, you don't have to do anything. But if you're the person who's actually calibrating it, you have to push the alarm silence and the alarm reset and hold them in while you turn it on, and the on-off switch is down here on the bottom. So you press those and you hold those in until the screen comes up.
Why do they do that? We just have told 2 random buttons.
Oh, to do the test? Yeah, go ahead, set up, yeah.
Why don't we just put 1 more button on?
But it goes to 11. Oh, no, nothing.
And I guess I didn't hold them good enough because it's...
It's the other 2. Not
The other 2?
alarm, not the silence, but the
Oh,
other
it's
2.
the reset in the 100%. Thank you. So, excuse me, reset in 100%.
Again.
Parkview.
Why?
That's right.
Start over again.
Because it's in, what's it called, what the hell it's like, look, my speaker, it goes to 11.
Why can't they just make it the 2 on the
Why
end?
don't you just make it 10 louder?
That would make more sense.
But it goes to 11.
Rancho, Parkview.
Yeah, Parkview, Rancho
Corona.
Springs, Inland.
Corona does.
Huh?
Corona does.
Corona does too? A lot of places do.
That's what it's
Okay, now it says morning, entering diagnostics mode, verify that the patient is disconnected prior to proceeding. So we don't want to have our lung attached. It's probably actually going to be best for me to come onto this side. So now we're going to be able to say, okay, can you still see? And then we can do start SST, is what we want to do. Verify the patient is disconnected and unplug the patient Y. So we're good, all right? Plug the patient Y. Some of these tests are not going to pass because a couple of them are not passing, not because of anything we're doing wrong. So just know as you go through it, as long as you follow directions, you're fine.
Can we put a filter on that?
We want to know about a heated circuit.
Like for heated circuits, a filter?
Mm-hmm.
Where?
Well, there's a filter right here, and if you had a heater, it would just be mounted down here.
Oh, you know.
Yeah.
Some of them have like a little mount on it.
At Parkview, they all have.
Yeah.
Yeah, there'll be a little metal plate that you can just slip the heater right into. So this is not passing, so I'm going to just keep going. And so you're just going to do what it tells you to do. Just kind of like the other PB. It's kind of similar to the PB. It's just going to run through all the different tests. That one failed. SST failed. Okay. I do the EST.
Do you want me to hold the plug?
Okay. So did the blower test, that one passed. Oxygen supply test. Disconnect the oxygen supply from the ventilator. Then you push OK.
Why are some of them called SST and some of them are EST?
SST is a short self-test and EST is an extended self-test. It's the longer one. Now it's telling us to connect the O2 back in. I might not be able to do this with one hand. Can you, somebody? I know, I'm not tall enough.
I could see myself just eating it real quick. Good click.
This is that Final Destination moment where it busts off the wall and just like slaps everybody in the face one at a time. Just takes it all out.
I think it's on, but it didn't click at
It's,
all.
I don't think it's in.
Someone else want to try to muscle it in, maybe?
Well, it's hard to get in those over the tables when you're short. It's just. Oh no, it's not. Yes, it was in.
It wasn't.
It wasn't. Okay, it's just not clicking.
There we go.
Okay. So now we'll hit OK.
Thank
It
you.
wasn't for the record.
You got it.
Yeah, it was.
I can. I can do it.
I have to actually climb on top of the table. The table is the problem.
I do like these chairs compared to other classrooms.
Yeah, I do too.
There's chairs?
Yeah, you can't get better than these chairs.
I like to go like this all the time. And then the other.
Those chairs.
Those are nice ones. The other ones in the math class, oh my gosh, those are the best chairs ever. They lean back like
Oh, so you can just like fall
Yeah.
backwards onto the floor.
you're just like chilling.
They got like
No,
that
they have like a
full
kick.
back.
They have like a kickstand, so like you lean back to a certain point and it just like chills there. You can just lay back.
Great.
Could you imagine
Not
if they had those chairs like that?
Okay, the
Well, I wouldn't know
oxygen
if that
sensor is
would
not
work.
connected to the ventilator. Don't worry about that. Just say okay. You wouldn't do that, of course, if it was a real patient. You want everything to pass. If you're going to actually be in the hospital, all of these tests have to pass.
Remember the good old days?
I still do it, right?
Oh yeah, you still doing it at Rancho? Yeah,
Yeah.
you still got those.
They're used at a lot of the hospitals in this area, this one. It has some disadvantages, which I'll talk about, but
When you get sent to another hospital, are you gonna pat it and cry? Sorry. Okay.
now it's testing the pressure relief valve. That's just the valve that would open up if the pressure got too high. Yeah, we know. Exhalation valve, now it's testing that. Patient circuit test. Audio alarm test, yes, we hear it, it's good. Is the backup alarm, you
Yeah.
hear it, you're good. Is the remote alarm connected?
No.
No, a remote alarm is an alarm that you could put like at a nurse's stations. If this was in a room on a regular floor, you could put in a remote alarm at a nurse's station.
Kind of like a
So
baby,
that's like a baby monitor, yep. So we'll say no to that.
Yep.
Is the normal LED. Now what it's going to do is test all of these. So it's going to have you look and it says, is the normal LED flashing? You see that it is, so we said yes. Is the high alarm flashing? Yes. Low alarm flashing? Yes. And we're just going to keep going through these. Yes, yes, yes. Press the alarm silence. Alarm reset, 100% for 2, manual breath, screen lock, expiratory hold, left options, right options, and accept key.
And turn the dial.
Turn the dial. ESD failed, yeah, I know. So it says cycle power to ventilator, cycle power to start the ventilator, turn it off, and turn it back on. So now we're good.
And then that time when you turn it back on, you don't have to hold the two.
Right, you just turn it on this time. Because if you'd hold it, it'd go back into that mode again. So you only hold the 2 buttons in when you want to actually do the EST or SST test. If that's already been done because it's patient ready and it's bagged and you know it's good to go, which is how this normally would be, they'd be sitting, as you've already seen, they're sitting in a section that says they're patient ready. We're just going to turn it on now when we go to do our patient. So no backup battery connected, that's okay. We could have an external battery like down here that would work if the internal battery ran out. So I'm going to go ahead and hook up our lung. So that alarm, why are we not? Okay, I'm going to have to turn it off and turn it back on. But this alarm that you're hearing right now is a high priority alarm, and this is how you can hear the difference in the alarms on this one. High priority is loud and it flashes red. Medium priority would flash orange, and low priority would just be a solid color. So that's how you know. So this one, you know, it's important. Right now, the ventilator's not even working. So we sent this for service, just so you guys know. This is one of the ventilators that we own, we don't rent. And it was like, I don't know, $5,000 or $6,000 for them to do the service, to check, to see what they needed to do, just to find out what was wrong. This ventilator is being phased out because there's a new version called the V200, which is just like this. It's kind of like the Vision and the V60 from the V60 is the newer BiPAP. It's very similar to the Vision. The V200 is the newer version of the Esprit. So if you look at, because like if you go to Parkview or some of the other hospitals, the screen looks exactly the same. It's just in a newer, updated housing system. So this model itself is being phased out. So it makes no sense to spend the money. So if it actually gets to the point where it won't work, we're going to rent a V200 and turn in one of our other vents that we have multiple of. So that's why that's just so you guys know, that's why we're not fixing it. But it still most of the time does run. The blower is what sometimes doesn't come on, and we'll hear it come on here in a minute if it's going to cooperate.
Yeah, didn't they have like one of those models at Parkview? They had like 2. They still have 2 like old school like that one. But
Mostly the
yeah, mostly the V200. That's why it tripped me out when I saw that the screen is exactly the same.
Oh yeah, I didn't know that either. I was like, oh wow, check it out. There we go. So now we're good. Okay, so on this vent, up here at the top is where we can set our set settings. So, and you can also change your modes down here at the bottom. So VCV is volume control, and you can do AC, SIMV, CPAP. You have to, when I do these, I have to go between all 4 of these vents all the time. I have to like, which vent am I on? So right now, because you see AC lit up here, in VCV, we're in ACVC. If you had SIMV lit up like that, And that, you would tell you were an SIMV VC, so SIMV volume control. If you're ACV, no, I don't want to change it. Now, if you wanted to do AC PC, AC pressure control, then you have this AC here, and then you go down to here and do pressure control, PCV settings. And then those will come up. And then you could do the same thing for SIMV, sorry. Then you have to hit the green button that says activate PCV. And that's right up here at the top. Change to pressure control ventilation, I can hit OK or review alarms. Best thing to do if you're going to change modes, go in and double check your alarms, so you can hit review alarms and then OK, but for now I'm just going to do OK. And now you'll see up at the top here it says PCV AC, it's actually switched. So just like the other ventilators, you actually have to confirm your change. Pretty much there's no vent, you can just push a button and change a mode. You have to go in, change it, and then hit like a yes, I really want to do that, so activate. But you can go between SIMV, yes. So you can see you can go between AC and SIMV without actually hitting that activate button. It just gives you a confirm yes button. If you're going to change between volume control and pressure control, you have to actually activate it and hit that button. So once you do, here's all your settings that you can set. So we're in SIMV right now, so it's giving us options for pressure support and rise time and things like that. For over in AC, it's just going to give you the settings that you can set. O2 is here, and then your apnea backup is over there. Here's adult and pediatric, so if you had a pediatric, you could hit the little person picture. One of the disadvantages to this ventilator, I personally feel, is it has nothing beyond ACVC, ACPC, and SIMV, VC, SIMV, PC, and like CPAP and pressure control. I mean, CPAP and pressure support. There's no PRVC, there's no bi-level, APRV, any of those other, you know, PRVC is a pretty standard mode now. This ventilator does not have that as an option. So you can only do those basic modes. So if you have someone who's having trouble oxygenating, and there's not a lot you can do on this vent except to have them in pressure control. So some of the hospitals have some other vents that would do more of the advanced things, but this one does not.
Does the new one have the new settings?
No, it does not. Question?
That was my question.
Oh, okay. Nope, it does not. It's just always been kind of a basic ventilator. So it fits, you know, 90% of your patient population. So, and it tends to be used at smaller hospitals, although Parkview is fairly big for that area. Some of the other hospitals, if patients are that sick, a lot of times they get shipped out anyways. So they would go to a hospital that has those advanced modes that they need. So, okay, so that's there. And then here in this little window here in the middle, right from the screen, you'll see some basic patient data. So from here you can see your PIP, your MAP, your total respiratory rate, your minute ventilation, your tidal volume, and a leak, if your patient has a leak. And then if you want to go over here to patient data, then that's when you can see actually more on the screen there in the little waveform.
You can see you can get the static compliance and the dynamic compliance too if you go to
oh yeah, that's in
single
another.
loops. Oh
Yeah, we're gonna get there. And then alarm settings. Here's where you can set your alarms: high pressure, low PEEP, low tidal volume, high rate, high minute ventilation, low minute ventilation, and apnea. And then monitor. This is a lot of times where they'll leave it in between patients. So from here you can see your exhale tidal volume, your rate, your minute ventilation, your PIP, and then these are your actual settings. So this is your basic patient data, and these are your basic settings that you're on. In this little box window here will be your alarms that are going off. So you'll see the last ones. The most important high priority alarm will always be at the top. So it was saying high respiratory rate in red. That's more of a high priority alarm over low inspiratory pressure and low minute ventilation. And it's also the last one that went off. Questions so far? Pretty simple, huh? It's really basic. So NPPV, if you wanted to do NPPV, you could do it there. In this little box that says option that is not, it's shaded out, that is actually a place where if the ventilator had it, you would see a tab for speaking mode. And what speaking mode is it's a mode that allows our patients to spontaneously breathe while on the ventilator. And of course, the other ones can, and they can do passing mirrors. What's nice about this is it automatically, if you put it in speaking mode, and you take down your patient's cuff, and you have it's fenestrated as well, and it actually will work with either kind as long as enough air can get around the tube. It will automatically direct the air, because the cuff is down, the airflow will get directed through the patient's vocal cords so they can talk. And then by being in speaking mode, it adjusts all the alarms all on its own so that your alarms don't go off. Because if you deflated your cuff, normally you'd have your low tidal volume alarm going off, your low PIP alarm because of the leak. So by putting it in speaking mode, it automatically will compensate for that for you, which is a nice feature. This ventilator doesn't have that as an option, but I think the ones, I thought they did, yeah. So you'll see that that's what that's for. If you go to the, oops, let me go back a screen. It was a little screen with the lungs. It had a little picture of a lungs on it. This is where you would allow you to do your compliance and resistance. So you can do your plateau, but you need to be in volume control. So if you're in pressure control, remember, as we started talking about, we don't really do plateaus because the plateau is going to be the same as our PIP. And how can we monitor compliance if we're in pressure control? Indirectly. What would help us tell us if our compliance was getting worse or better in pressure control? The tidal volumes, right? Yeah. If you're in pressure control and your tidal volumes over time are getting worse, your compliance is getting worse. If your volumes over time are getting better, your compliance is getting better. So when we're in pressure control, we look at our volumes to tell us how our compliance is. So we need to be in volume control. So I'm going to go back over to volume control. So we're going to hit VCV, activate, say OK. And then the little picture of the lungs here is the one you want to hit. So hit that. And then do static C and R, static compliance. And then hit start. Stop. And it'll tell you that there's a box that comes up with your compliance and resistance. Right there. Yep.
What box is that called again?
You hit the
first time
picture,
you hit it?
the little lungs, the picture of the lungs. And you also can see your patient data from here, so you can still make sure your patient's doing okay, which is nice while you're doing that. So it'll come up in that box and you just do, okay, I'm happy with that. So we'll say accept.
And it fills it in.
Yeah, and yep, it puts you, and then it's right here in the box. So, and then, so there's your plateau, there's your compliance, and there's your resistance. So all the numbers you need for your vent check.
I know one of the other RTs, we had an issue with this at the hospital that we were at, and she calculated compliance by doing an inspiratory hold on her own.
You can do that too.
I didn't quite understand how do you know how much of an inspiratory hold you need to...
You just do it for a couple seconds.
Okay.
In any ventilator, if you can't get the stuff, it's just like if this one has tools for compliance and resistance that actually say start and stop. But if this doesn't work, you just do it the old-fashioned way. You go do an inspiratory hold, get your plateau, and calculate it. And for some reason, I don't know why, the vents numbers for compliance and resistance are different than what you'll get when you calculate them. So some places and hospitals will make you calculate them anyways to make sure you get the most correct, accurate information. Let's see. Oh, the other thing I was going to show you about you can also, if your patient, if you wanted to, you could do a MIP procedure through the ventilator. MIP is the same as what?
NIF.
NIF. So for weaning, we could do that right through the ventilator. You could do your vital capacity through here as well. And then, our patient's not spontaneously breathing, so we can't do it, but that's where you would do it. And then patient status will go back to your window so you can see all your values and know where your patient's at. You can also go to this little picture that looks like a flow waveform to get your graphs. So if you want to see what your graphs look like as we go along more, I'll be teaching you how to look at air trapping and things like that. That's where you can see this from this screen. Really neat thing about this ventilator is so you can do waveforms or loops. There's our loops, which we'll learn more about later as well. One thing you can do on this ventilator is do freeze, and it'll take a picture, and then do continue, and then it's supposed to have a place to let you like basically copy it, but no, I'm not. This ventilator might not have that as an option because it's normally, yeah, it's not here, but you would do freeze and then save and then continue, and then you can do an overlay. I know that's a lot of information, but what it lets you do is like, say you wanted to look at your loops before and after a breathing treatment. So you take a picture of that, the scales and the loops before, and then you do your breathing treatment, and then you do another one, and you basically take a picture of it by hitting freeze and continue, and then you overlay it, and it would put the two on top of each other so you could see if it got better.
Oh.
So it's actually really nice. It's kind of a little complicated though to do on this vent. A lot of them you can just hit a freeze button right there, and it'll keep the first one and then do the next one that you want later and show you in two different colors. So, because when we talk about waveforms after the midterm, that's way down the road. There's some really valuable information you can get from them. So, you normally would be able to do freeze. It would take its picture, you would do continue, and then there would be a button here that said overlay, but it's not here, so it doesn't have that option. Are there any questions? No? You guys are easy today.
Everybody tired.
I know, it's long days. So what time is it? Oh, it's about that time anyway, so no questions about this one?
That one's pretty, I think, out of all of them.
Can
Yeah.
you show me how you do it with the inspiratory hold, where you do it manually?
Yeah, come on. Okay, I don't see the, no. Hold on a
saw
second.
them, I think, do it from
Can you do it on any screen, or does it have to be a particular screen?
right here, right?
Oh, there it is, yeah, thank you.
Okay.
So you're gonna just take your inspiratory hold, because we used to have a ventilator
That's
up
what she
north
said.
that, the tool for compliance, it never worked. So we always had to go in and do an inspiratory pause. So if you just go here and put the inspiratory hold on for about half a second, accept, and then we gotta go to patient data. Oh no, actually, I think sorry folks.
There, plateau.
Yeah, then if you go to monitor and patient status, your plateau pressure will be right there. So you put your inspiratory hold on, go to monitor, patient status, and then your plateau pressure will be there. But then you have to make sure you go back and you turn your inspiratory hold off. You never leave an inspiratory hold on a patient. There we go. So you're gonna go in here and then decrease it back down to 0 and hit accept. One other nice little thing about this ventilator I forgot to tell you guys. One last thing. On the main screen here, this is the only alarm you can change without actually going into the alarm settings, and you can do it right from the main screen here, is the high pressure alarm. So there's a little thing over to the side next to the pressure bar that says HIP, it's high inspiratory pressure. You press that, and right from here you can increase or decrease your high pressure. And what's the max peak pressure that we want to try to prevent barotrauma? 35. What about plateau? 30. If your plateau gets to 30 and you're in volume control, what are you going to do? Pressure control. All right, good job. Okay, so any other last questions? All right, so next week we'll do the demo on the Avia, and that'll be the last actual demo of the ventilators as we're still working through our labs on them. So are you posting those online anywhere, Desiree?
I haven't done the last few,
Okay,
but
but you have the other ones? Okay, great. All right, so if you want to go start to help me put this away, then I need to give you your homework assignment, and we will be